us the sharing of the data. So in regards to collection, we tried and figure out the parameters that we are looking at. One of them being households, livelihoods, that's economic activities, things to do also with the number of people who've been affected, the special cases, because even for Red Cross, I didn't see something regarding pregnant mothers, people living with disabilities, the elderly. Maybe it was in some other data, but I didn't see it in the presentation. But that's a segment that we can't leave out because those people are also affected. And then also now, in regards to how do you collect that data? So one of the methods in terms of data collection that we are looking at was community-based data collection, whereby you involve community partners. Those can be either CBOs, community-based organizations, the village heads, the Nyumba Kumi groups, even the headmen within those areas, including the leaders who are usually in informal settlements, which are usually most affected. And then, apart from that, we looked in terms of interviews, and when we looked at interviews, we were regarding something to do with data privacy, and here is whereby we came up with something that's anonymous. When the data is being collected, you make sure that there's a lot of anonymity in order to protect someone's data. So for this one, we suggested for the data collection, we would rather segment it. Like for informal settlements, they're more comfortable with interviews. For areas that are a bit urban, we can consider doing online interviews that don't require you to fill in your details, your personal details, but it's just a quick questionnaire to help us in data collection. As we move on, then we looked into presentation. And before I move to presentation, we touched on partnerships, one of them being private and public kind of partnerships, whereby the researchers who are in the private sector can also partner with organizations like the Bureau of Statistics, which is from government, Red Cross, and also other NGOs that are heavy on research, that is. And find a way in which they can work together, in which now they can make the data somehow simplified, because you understand it's a complex, it's very technical. So finding a way in which they can simplify the presentation, ready for sharing. Okay? And then one of the areas in which now we are creating the dissemination, that dissemination now is in terms of creating the awareness of the data that has been collected, because the problem is there's a lot of data, but we don't know where it is. We don't know how to access it. And so at times now we are looking at having a diverse mix of sharing information that can be either offline as well as online. When you speak online, first of all, you need to address the challenge of digital divide. Because at times, you know, there are things that are shared online, but someone may not access data. Someone may not afford to buy the bundles to access that kind of information online. And this is where we had mentioned things to do with partnerships, whereby even the telcos probably at that time can consider discounting the data or find bundles that are accessible and affordable to a select number of groups in order to access that kind of data. Data protection is something that also has to come out strongly, because we don't need to mention the sources or the particular individuals who've given us the data. That should not be shown on the presentation. And then I'd mentioned something to do with data, community-based data collection. And then data sharing. There needs to be a standardized format in which that data is shared. Perhaps if it's for people who are living in informal settlements, are they okay with posters? Are they okay with radio announcements? Are they okay with announcements from their local authorities? If it's people who are living in urban estates, would they rather prefer infographics? Would they refer maybe the news on mainstream media, or perhaps a tweet from the official channels that communicate disaster? And then also there needs to be expanded internet access. There are areas that don't have that kind of access to internet. So government probably should work in terms of infrastructure that can enhance that kind of internet to access the online data. Still on the line of communication, you're looking at, in a country where you have 44 plus tribes, and there are people who don't understand English or Swahili, despite it being the official language. So there should be options in which probably you can put it in vernacular, or through vernacular stations for people to better understand, people on the ground. And also looking at special cases, because you can imagine people who are deaf, how do they know that there are floods? How do they get that warning? At least someone who's blind can hear, but someone who is deaf probably apart from seeing, can't be helped much. So data that can also address the special needs of the audience and the citizenry. And then as we create that kind of data in the presentation, also we need to look at the historical data, because that one will help us in mapping. What happened in 97? What has improved since 97? How can we map this country? Which are the high-risk areas? Which areas need access to health facilities for emergencies? Which areas need maybe access to what do you call these guys? Firefighters or rescuers or rescue centers? And then as I conclude, the objectives need to come out clear, the objectives of the data. That could be internally before it's shared externally. That is in terms of helping in resilience building. That's for future planning. Also historical data and risk modeling, that just as I mentioned, in terms of mapping. And also having long-term mitigation strategies. It's not all a matter about firefighting, but also understanding that based on historical data, probably it floods every 4 years. So there are high chances that maybe in the next 4 years there will be another flood. So how ready are we for that? Yes, and that's it for me. Thank you very much.
Thank you so much. And I think I like the fact that you brought in the people living with disabilities and ensuring we have social inclusion. Because you're right. Actually, they're the most